Dear friends, when we look at women's health at large, and as an obstetrician gynecologist, what is it that we are looking at? We have actually moved from the MDG goals to now the Sustainable Development Goals. We have failed to meet up to the MDG goals, and we hope that we will be able to at least achieve the SDG goals. There are so many problems as obstetricians gynecologists which we see in our women, which has an impact on the long-term health of not only the woman but the baby and the family, and of course later on the general population at large. So we are actually used to seeing a lot of problems, like right from infections to anemia to so many other problems during the pregnancy. But now when we look at our population, when we look at our women who are getting to the reproductive age group and those who are becoming pregnant, unfortunately we find the non-communicable diseases is taking a very big stand. And we find that among all the NCDs, gestational diabetes, mellitus, the GDM has come up as a very big issue which has to be tackled on a war footing. Now, why are we obstetrician gynecologists talking about GDM? When we just look at the overall statistics in our country, we find that the incidence of GDM is increasing, so much so that we are wondering whether now India is almost becoming the capital of diabetes, not only the general diabetes, even the gestational diabetes. So now we have to sit back and think, what is it which is making our women more prone for this non-communicable disease like diabetes? And we have to look at factors which are increasing the diabetes among women, and especially when they're pregnant and when we find more cases of GDM. So the incidence is definitely increasing to a very high proportion. So that's the reason why all of us have to sit back and immediately start thinking, how is it that we can reduce this burden in our women, especially our pregnant women, and try to see how we can curtail this problem in the country.